or spend time rehashing the past. Problem solving is a skill like playing the piano or skiing. The more the patient practices, the better they will get. The better they get, the faster they will be with the process. It can be helpful to show the patient how they solve lots of problems every day. Every time they make a decision, they're solving a problem, whether it is what to wear, what to eat, or what route to take to work. Think about the cycle of depression through the lens of problems and unsolved problems. When we can't solve a problem effectively, it can lead to emotional as well as behavioral difficulties. Unsolved problems can result in a lower mood, which then make it more difficult to address the problem. Depressed mood or unwanted, unmotivating moods can also be a signal that there might be a problem in our lives that needs to be addressed. The goal of problem solving is to interrupt this cycle with action. We have mentioned that problem solving, as well as other behavioral interventions, help patients cope with emotions, problems, and stress. Stress, like other emotions, is important. It provides us clues to our environment, as well as to our physical and emotional state that can keep us safe. Stress can motivate or shut us down. Stress also comes in many forms. Stress really just means that a change is or has occurred. It's really important for us to remember that depression can be a hallmark of suicidal ideations and planning. We're going to watch a short video.
Diagnosed with Crohn's disease and struggling with your symptoms? It's not too soon to talk to your doctor about Entyvio for moderate to severe Crohn's and learn about the results you need, including rapid symptom relief and long-term remission. Entyvio is the only gut-focused treatment for Crohn's that helps block inflammation in the gut and works right where you need it. Infusion and serious allergic reactions can happen during or after treatment. Entyvio may increase risk of infection, which can be serious. Although unlikely, PML, a rare brain infection that can result in death, cannot be ruled out. Tell your doctor if you have an infection, flu-like symptoms, sores, or are prone to infection.
I do want to apologize for this. YouTube added in some commercials on some of the videos, and the skip button just pauses everything, so hang in with me for just another moment.
Liver problems can occur. Learn more about the only treatment for Crohn's that works right where you need it, and ask your doctor about gut-focused Entyvio, including the Entyvio pen.
Gut-focused Entyvio.
The thrill of winning never gets old.
But at Farah & Farah, it's not just about us. It's the thrill of fighting for our clients. That's why we're so relentless, to get our clients every dollar they deserve.
It doesn't get more fairer than that.
They're right, it was the only option. The problem appears to be unsolvable. Maybe we could run some computer simulations.
There are too many variables. It would take forever.
We've got to be missing something. Let's start again. The movie is playing here at 7:20, here at 7:40, here at 8:10, and here at 8:45.
All right, these theaters have to be eliminated.
Why? They're state-of-the-art, digital projection, 20-channel surround sound.
Yes, but they have no icy machines. Despite my aggressive letter writing campaign, I might add.
What about the multiplex here? The seats are terrific.
They have Twizzlers instead of red vines. No amount of lumbar support can compensate for that.
Well, it's going to take at least an hour to eat, and I don't see a Sheldon-approved restaurant proximate to a Sheldon-approved theater.
We could eat after the movie.
Unacceptable. The delay would result in tomorrow morning's bowel movement occurring at work.
Hang on. There's a 7-Eleven here. We smuggle Slurpees, which are essentially ices, in under our coats after having a pleasant meal either here, or here.
Wow. I don't see how we missed that.
Excuse me, in what universe are Slurpees ices?
That's how we missed it.
Sheldon, would you be prepared on a non-presidential basis to create an emergency ad hoc Slurpee icy equivalency?
Oh, Leonard, you know I can't do that.
Okay, I guess we only have one option.
Yep, I don't see any way around it.
Bye, Sheldon.
See ya.
Later, dude.
They're right, it was the only option.
So that was just a quick, fun way of looking at problem solving, and showing that problem solving can apply across the board to a variety of problems. So when we're looking at the goal of problem solving, problems are a challenge that everyone faces. They don't indicate a character flaw or that someone is a bad person. The goal of problem solving is to develop skills that a patient can use today and in the future. It will increase their confidence and empower them so that when problems arise, they can do something about it. It helps them to reframe problems as challenges. It reduces avoidant behavior that becomes very stressful situations. PST helps the patient understand that not all problems are solved the first time, teaching them how to evaluate and make tweaks or revamp the goal completely as needed. By proactively looking at barriers and what has hindered their efforts at problem solving in the past, we can help them increase the chance for success. When we effectively solve stressful problems, this can lead to better emotional and behavioral states. PST focuses on solving current issues and set future goals that will support well-being. It is a systematic process. Patients learn more about themselves. They become the experts on their own lives, behaviors, and emotions. This helps patients gain a sense of mastery and learn skills that can be used again in the future. It can be used to help prevent a relapse. It helps individuals adopt a realistic view of coping, understanding the role of emotions, learn to identify barriers, and creatively develop an action plan. PST does not need to be delivered in traditional therapy settings. PST is helpful in collaborative care and primary care settings. It's evidence-based technique for the treatment of anxiety, depression, and other diagnoses, which happens to be the target population of collaborative care and what is seen most often in primary care settings. It teaches a set of skills that a patient can use throughout their life, not just while working with a professional. It is structured, time efficient, and patient-centered. The steps can usually be taught in under 20 minutes. It lends itself to the primary care setting, and it can be delivered in person or virtually. So we're going to watch another short video here, but I just wanted you to start thinking, what are some of the problems that your patients have? So what do you hear most about from your patients, problems that they experience? And then also start thinking about what happens when we feel stuck. And if there's anybody who would like to take themselves off mute and share, what are some of the problems that you hear your patients discussing the most? That would be fantastic. Or if you'd like to take yourself off mute and talk about what happens when we feel stuck. I know when I'm in the middle of trying to solve a problem and I feel stuck, I can feel emotional distress. I can kind of blank out on what some of my coping skills are. So this is a video that, yes, go
Deborah,
ahead.
sorry. We just want to let you know that people might need to respond in the chat since
Okay.
mics are muted.
Okay, absolutely.
Yeah.
If anybody would like to put in chat what problems they hear most from their patients, please feel free. So So while you might be putting some in, I'm going to show another video. And this is a good broad explanation of problem solving. And with this video, again, they might show a commercial, so please bear with it if they do. And although she's talking about older adults, it is the same process across all ages.
One of my areas of focus is problem-solving therapy, and that type of therapy really is a systematic, common-sense way of sorting out one's everyday problems. Depression's common, and it's often caused by these everyday problems that people have. Some people have big problems, some people have small problems, and utilizing the problem-solving therapy skills helps you better cope and manage those problems on a day-to-day basis. When people are depressed, they have a very difficult time dealing with their problems. And it becomes a vicious cycle because the more depressed you are, the less you feel like doing. And the less you feel like doing, the more depressed you are. And so what problem-solving therapy really aims to do is to break that cycle and to interject and to, allow the patient to regain some control over their problems. It's a collaborative relationship where the therapist really is there to be encouraging and supportive, but the ideas and the action plan, that comes really from the client themselves. So problem-solving therapy is more effective with older adults who have mild to moderate depression. The client needs to be able to concentrate. The client needs to be, ready for the change and have the willingness to kind of engage in the process. For a client who would be interested in problem-solving therapy, I would really commend them. I would commend them for coming in and for wanting to try and to learn about a different kind of therapy, because this therapy is really a learning behavioral type of therapy, and this therapy is unique in that they learn a skill and they take the time over the weeks to really learn it and hone their skills with the therapist, and then they take it with them. They take it with them when the therapy is over, and it's our hope that they can use those skills to apply to their problems that they may encounter today and they may encounter in the future.
Jason, I'm wondering if you are able to share what people have put in chat. I, in Teams, don't have the ability to see chat.
Absolutely. A few things that have come up are feelings of hopelessness. I feel helpless and I feel uncertain. I hear clients bringing up the political climate a lot and they feel helpless and frozen. We have one on frustration. Some more on the political climate, a couple comments on that as well. Family stressors and work stress, feeling hopeless or out of control in your own life, work stress, relationship stress, financial worry, health worries, health anxiety, family conflict, marital struggles, political issues. I don't know how to make my relationships better, work stress better, the world a better place. A big problem I see is people feeling stuck in their lives and not able to move or change.
Yeah, so
summary.
Yeah, thank you. Yeah, absolutely. It sounds like you're hearing some of the common things and themes going on, and exactly what ends up happening, feeling frozen and stuck. If we don't have the skills or we don't trust in our skills in order to solve problems, we feel stuck and then we're moved to do nothing but worry. So absolutely. Thank you so much for participating and putting those in chat. So when we're looking at problem solving, again, we're looking to help our patients with what's going on currently and moving forward and having a skill for the future. So our guidelines when using problem solving, when we're working with our patients, we need to teach them the techniques involved in healthy problem solving, underlining the word healthy there, right? Because unfortunately, we've all engaged in problem solving that has not been to our benefit. Remember, this is like any other skill. It must be practiced to gain mastery. It is important to encourage your patient and help them find where they have been successful in the past and build upon that. So we've all also had times when we've been successful. We may have had more times that we were unsuccessful, but we really need to help our patients find the times when they've been successful so that they build their confidence, they feel as though they can take on something new. And of course, we can do this using motivational interviewing by being patient-centered and developing a rapport with our patients. When using this, we need to make sure we're asking open-ended questions to clarify what's going on and help them figure out what their goals are, using reflections and, of course, asking permission. We are cueing patients in what to do next with the process, using teach back to ensure that we're all on the same page, and then often we can summarize for the patient what is going on and what a plan might be. So these are the 7 steps of problem solving. During problem solving, you will help patients start to see problems as challenges to be solved instead of insurmountable obstacles. It also means that they will recognize that action is required to engage in effective problem-solving techniques. And we'll discuss each one of these in greater detail in the following slides. So looking at step 1, identifying and clarifying the problem. In this, we really need to emphasize personal choice. Even when a problem may seem obvious to you, it might not be obvious to the patient. You need to help move the patient towards more objective problems. It can be difficult, but the patient should choose their goal regardless of the BHCM's thoughts on what needs to be accomplished. You need to develop a problem list with the patient to help them get a clear picture of what's going on with them. Guiding the patient, narrowing down to one succinct problem. If possible, start with a simple problem that can build mastery. Break down large problems into small steps. The more they have success, the more they're going to be willing to engage. So how again do we do this? And again, it's motivational interviewing. It is important to clarify problems. If problems are nebulous and not well defined, they are impossible to solve. Let's look at a patient stating that they want to feel less depressed. We would need to define what their current level of depression is, what measure they would mean that they're less depressed, what behaviors would show this, what behaviors and feelings does the patient identify as depression. So if you look at the statement, I want to feel less depressed, there's a lot of unknowns in that statement. We might say to a patient, tell me a little bit about what depression looks like in your life. When do you feel better? Helping focus on something in a more positive light. So when do they feel better? Getting a picture. That patient may respond that they feel better when they are with other people or when they're doing a group activity. That helps narrow down what it looks like for the patient. The problem statement after that might say, I isolate myself. Picture it as a funnel. It starts off really wide at the top, and then we keep working with them asking questions until we get down to something that is specific and narrow that can be that the patient can move forward with and solve. So we're going to take a moment and look at clarifying problems. So here are some possible statements that you hear from your patients. So the patient might say, my life is out of control. And again, though, if we ask 10 people what that means, their life is out of control, we would likely get 10 very different answers. It is important to help the patient identify what it means to them. So through a conversation with them, we might identify one of the things that is making their life feel out of control is they're working 60 hours a week and have no balance in their life. Same thing could be with a patient that reports that they feel terrible. We again, using MI and our ORs, asking those questions, we realize that for this patient, what's causing them to feel terrible is they're forgetting to eat throughout their day because they are busy. So I'm going to enlist Jason's help again. So typing in chat, let's look at another example. So you have a patient who says, I'm in trouble at work. So what might be a question that you would ask the patient to help decide what that means? I'm in trouble at work. What might be a question that you could ask to help clarify?
Can you tell me more about that?
Absolutely.
What is your problem at work?
Yeah.
Can you describe more what you mean by being in trouble?
Wonderful.
Tell me about what's going on at work. What
Fantastic.
makes you feel this way? How do you know it's a problem?
We obviously have a lot of very skilled individuals in motivational interviewing here. Great job, guys. Thank you. So we're going to talk a little bit, do a little more practicing. So we're going to talk a little bit about Sam. Sam is a 35-year-old who's been referred to collaborative care following a diagnosis of depression by her primary care provider. She has 2 school-aged children. Her partner is very helpful, yet often travels for her job. Sam's mother is declining in health and may no longer be able to pick up the kids from school. Sam is unhappy at her job, yet feels overwhelmed when thinking about finding something new. She states that she doesn't feel like she's doing a good job as a mother or an employee. Sam has thoughts that her family would be better off if she was not around. She is having trouble getting dinner made most nights and packing lunches for the kids. She is no longer exercising or attending her online parenting group. She misses her friends. So, enlisting Jason again, if you would please type in chat, what are some of the problems that you see that Sam has identified in this conversation? So, what has Sam identified as possible problems in her life that she might want to work on?
Lack of support, getting help with childcare, priority and time management, multiple, sometimes conflicting roles, stuck in her job, coping with mother's health and decline, stress at work, the caregiver burden.
Yeah.
Caregiver fatigue, meaningful job, feeling isolated.
Absolutely.
Being overwhelmed. Yeah, those are good ones.
Yes, and I think overwhelmed is kind of that summary of everything that is written here, right? Yeah, so in a short conversation with your patient, in this case, Sam, there's a lot of areas that they share that are causing stress for them in their life. We're going to come back to Sam in the future also, so keep Sam in mind. So we start by finding out what that problem statement is. And then we're looking at step 2 being setting a realistic goal. I'm sure SMART goals are something that you are all familiar with, and they are the best place when we are setting goals for a framework. It really does maximize success when we look at this as a framework. So when we're looking at SMART goals, just as a quick reminder, specific focuses on what will get accomplished within the patient's control. Measurable, the patient should know exactly what needs to be done and when it has been achieved. Achievable, The goal needs to be able to be accomplished in a reasonable time with the resources and skills the patient has or can acquire. The goal needs to be relevant, and which means it needs to be important to the patient. And the goal should have a time frame on them so that there's a prompt for the patient to work on and accomplish it. When we're working at the beginning and really teaching problem solving and goal setting, it's really important to focus on short-term goals, things that can be accomplished maybe before the next time you talk with the patient, things that can be accomplished in a shorter amount of time to, again, build that confidence and desire to keep moving forward. I think realistic is probably one of the toughest areas to look at in SMART goals. And it is vital that goals are realistic. We want the patient to be successful. We want to help them to continue that pattern of problem solving. Most of the time, when a patient does not meet a goal, it's related more to being a poorly defined goal than a patient failure. The patient may identify a goal that does not seem to relate to the problem statement that they created. This is an opportunity to explore both areas and possibly work backwards from the goal to the problem. What if the patient identified lack of work satisfaction as their problem and doing something outside the house as their goal? This is incongruent, but it's an excellent place to work backwards to see what the problem statement really is for the patient. If your patient identifies isolation as a problem and then wants to set a goal to interact with friends 7 days a week when they're currently not leaving the house at all, the patient is being set up for failure. Small steps that are more easily achievable will be the building blocks for future goals. Looking at step 3 is brainstorming solutions. Brainstorming can actually be a fun activity. It can also be a very difficult activity for patients, especially patients who are experiencing depression. Just as with other parts of problem solving, this is where you're going to deploy motivational interviewing to help. With some patients, you will do more following. And with those who may be feeling hopeless, you may be doing more leading or guiding, with their permission, of course. In this process, we ask the patient to envision all the ways they could solve their identified problem. There are no wrong answers. Answers are not judged at this time. We want to list as many possible solutions as possible. The more solutions, the greater chance of finding the one that will work for the patient in solving the problem. Often the best solution ends up being a combination of several of the answers that the patient gives. So you're working with your patient and the patient identifies the statement, I isolate myself, and the goal statement, I will do something outside the house at least 2 times per week. So remember, initially we talked, if somebody said, well, I'm going to do something 7 days a week, that's not sustainable or realistic. So this time the patient's saying, I'm going to do something twice a week outside of the house. So you engage in a brainstorming session with them of all the things that they might want to do outside of the house. And if they're really having trouble thinking of something, also ask them what they used to do in the past. What were some of the things they did in the past to get outside of the house? They may say that they could take their dog to the dog park, go shopping, go to a yoga class, meet a friend for coffee, go to the gym, roller skating, go to the casino, go to the bar. You may know through conversations with them that gambling has been a problem for them in the past, or that they have a history of substance use concerns. This is not the place to make the judgment. All suggestions go on the list. Patients will often share what they've tried in the past, even if it was not successful. There'll be a time for evaluation in the next step. So we're back with Sam, and let's take a look at moving forward from the list of problem statements that we got. So, excuse me. So we're back with Sam. So we had some great answers before: lack of support for the problem statements, childcare, time management, conflicting roles, mother's health, caregiving, isolation. So let's take a look at and pick one of those areas and do the next step. So let's say that as we talked with Sam and she shared all of her concerns and problems, that she decided that not meeting her role as a mom, feeling like she's falling short as a mom, is the area that she wanted to work on the most. So what might be, typing in chat, what might be a goal related to not meeting her role as a mom as she sees it? What might be a goal related to that? And as you're putting down a goal that might be related to not meeting her role as a mom, what might be some activities that she could do? So brainstorming some solutions to go with that.
So far, we've got playing a game with the kids or picking them up one day a week, make supper 2 evenings a week, order groceries instead of shopping in the store to save time, take your kids to the park once a week, carve out time to play outside twice a week.
Okay. Yeah. So taking a look at this, she could be saying, all right, I'm not meeting my role, and what I want to do is I want to make sure that my children have adequate food, because she talks about both, like not being able to pack her lunches or making dinner or having difficulty with those. So she might choose that she's going to provide food for her family as her goal. And some of those activities, like you said, making dinner 2 times a week, ordering groceries. Maybe it is packing lunches the night before, or having kids pack lunches with her, or putting money in their lunch account and having them eat hot lunch so she can focus on making dinner, right? So any of those things would all go into that brainstorming session of how to provide food or meet that role as mom that she would prefer. So once we do the brainstorming and we get a bunch of possible solutions, the next step is to compare them, looking at the pros and cons of each of them. Here again, it's really important that the pros and the cons come from the patient. So as you're going through them with them, they should be the ones who are able to recognize what are the positives and negatives. However, let's also put in the caveat: if the patient is overlooking an extreme negative consequence, it is your role to help them see that. Once we have a list of possible solutions generated, it's time to evaluate each possibility. With the patient leading, you will list the positives and negatives of each proposed solution. You will look at the feasibility and barriers during this process, remembering not all pros and cons are equal. Some negative consequences can have little effect, while others could be devastating. So as you're working with the patient, you're helping them to see and rate what these positives and negatives could look like. A simple example would be, let's say that you were working on a problem-solving technique with a patient and they were looking to buy a new car, and they had narrowed it down to 2 vehicles. And they said to you, one of them is an SUV, but I really don't like the color it's in. So the color is a negative. So that color being a negative to them might only have a weight of 1 out of 1 to 5, with 5 being the most serious. Whereas they may then say that the second car that they're looking at is a Corvette and it's a 2-seater and they're a family of 5, and this is going to be their only vehicle. So only having 2 seats for a family of 5, that negative might get the full weight of a 5. So when we're looking at them, it's not just pros and cons, but the weight of those pros and cons. A decision balance tree or graph is a great tool to use during this process. I also want to make a quick note. The first solution offered is rarely the best, as it's probably what the patient has been trying in the past and not been successful with. So here's an example of looking at a grid for decision making, a nice visual for your patients to be able to see. So the patient and you are reviewing the pros and cons systematically of all of those brainstorming activities that they came up with to help with isolation. So what you're looking at is, does the solution address the goal? Are there minimal barriers? Does the patient have the resources to accomplish this? And by resources, we're looking at time, energy, skill, money. Does the solution work without others involved and at various times of the day or night? So if the solution always involves someone else, it's going to be really tough if no one's available. If the solution only works during the daytime hours, then what happens when the patient is experiencing this problem in the evening or at night? So it needs to be able to fit lots of situations. So you're going to do the pros, the cons, and then the ratings. Looking at the ratings, the patient scored going to the dog park, going to yoga, and having coffee with a friend highest. As noted, each of these have negative consequences as well that can be accounted for at this time. This is now when we're looking at making evaluations. When we are looking at each of these situations that could have a con, such as going to the dog park, might be affected by the weather, or meeting a friend for coffee could be affected by them having a last minute something come up and not be able to meet us. Oftentimes it is best to come up with a solution that involves multiple options that can be deployed. So once the solutions are evaluated, one or a combination of them are chosen for implementation. In this case, the patient chose to implement all 3 of the highest rated solutions: meet a friend for coffee, go to a yoga class, walk the dog. And in this case, it could be something such as, if my friend cancels for coffee on Saturday morning, I will walk my dog instead. So now it's time to create the action plan. So now we have a problem statement, a goal has been set, solutions have been brainstormed, they've been compared, and a combination of them have been chosen. Now it's time to put all of this into a written plan of action. And I'm going to underline written plan of action. Remember to use your SMART format: specific, measurable, attainable, relevant, and time frame. By writing this down, the patient solidifies their plan. It makes it real. It takes something out of their mind and puts it down into the world. There are many templates that you can use to build this plan. You may have one in your EHR. You may be able to get one online. It might be something in a format that your patient is comfortable with. You will need to find the best way to get this plan to the patient so that they have a copy. Whether it's so if you're not meeting in person, will you email this to them as it's being created? Will you drop it in their portal? If you're in person, are you able to give them a hard copy so that they walk out with it? If it's a virtual copy, make a plan for it to be visible, such as their screensaver on their phone. If it's a hard copy, again, you want to help them make it visible. Maybe it's something that they put on their fridge or on their bathroom mirror, something that they see every day. Remember to start small. Focus on the achievable so the patient builds their confidence and willingness to work on their problems. If a patient is not leaving the house at all, planning to do something 3 to 7 times a week may feel overwhelming. Having too much flexibility can also cause alarm and inaction. A well-defined plan has the best chance of being successful. Although the patient identified 3 solutions that were combined into a more comprehensive solution, it does not mean that all 3 need to be implemented at the start. As the patient masters the skills going forward, you can add more on. Solutions can be expanded as well. And this plays into the last step of problem solving, which will be evaluating the outcome. So putting it all together might look something like this. The initial complaint, I want to feel less depressed. The problem statement, I isolate. The goal statement, I will do something outside the house at least 2 times per week. The combination of the 3 solutions that were brainstormed, take the dog to the dog park, go to a yoga class, meet a friend for coffee, and then the action plan of how they're going to accomplish this. I will take my dog to the dog park on Wednesdays after work and before dinner. If the weather is bad, I will move this to Thursday, and on Saturday mornings, I will meet a friend for coffee at 9 a.m. at Starbucks. If my friend cannot attend, I will go to the 9 a.m. yoga class. So we are looking at things being very specific, remembering our SMART goals. So let's take another quick look at Sam, and let's revisit where we're at and take a look at an action plan. So with Sam, we had a problem statement regarding not meeting. So the problem statement was that she wasn't meeting those mom roles that she wanted. The goal was to provide food for her family on a daily basis. And she brainstormed putting money into an account, packing lunches the day before, having her kids pack lunches with her. So it's an activity that they could do together. Ordering dinners off of Uber Eats. So all of those came in. So looking at all of those, a complete plan could be put in place there so that Sam could say, on Monday, Wednesday, Friday, my children and I will pack their lunches together after dinner, before bedtime. And on Tuesday, Thursdays, they will eat a hot lunch at school. And I will put the money in the hot lunch account on Tuesday mornings before I go to work. Or, I will order groceries and the kids and I will make dinner together 3 nights a week and order Monday, Wednesday, Friday, and order pizza on Tuesday and Thursday. Was there any other suggestions that people had as possible steps? Maybe focusing on the fact that Sam had thought, that it was better if she was not around, if she wasn't around her family. Were there any concerns that anyone had about that statement, if her family would be better off without her, that they would want to work on?
We have I would check the PHQ-9. Let's see. And ask her to explain her statement further.
Yeah. So using the motivational interviewing and asking those open-ended questions. So I like all the areas that we went to, but I do know that this is a group that is involved in the Zero Suicide Initiative. So for my own sake, I wanted to know what you might do when a patient says that their family would be better off without them.
Can you tell me more about what specific thoughts you've been having?
Fantastic.
Plan and means assessment.
Okay. Absolutely.
I would reassess after problem solving as well. Sometimes people have passive thoughts as a way to solve what feels like an unsolvable problem.
Yes, absolutely. So is this a passive thought? Is there, I heard someone say, are there plans? Are there intent involved? What does it really mean to not be around? Asking those questions and building on it.
Ask
Fantastic.
them,
Thank you.
one comment here was ask them directly, are you thinking about suicide?
Absolutely. We know
When you
that
s-
asking that question does not cause them to think about it. It's already there if they're thinking about it.
Absolutely. And finally, we have when you say that people would be better off without you, are you planning to kill yourself?
Yes. Great job. Thank you. So in everything we did, we covered the first 6 out of the 7 steps. So to me, step 7 is really the most important step. It is checking back in on the plan and seeing if the goal was accomplished. This is the opportunity to make changes if it wasn't successful. Remember, most of the time the goal fails, it's because the goal was not clearly defined. Maybe it was too lofty. Maybe the patient didn't have the skill set for it. It's almost never because the patient failed at it. It's very important to work with the patient to understand this so that they don't lose confidence or motivation. So if it didn't work out the way that they hoped, it's time for retooling with also reassuring. You can liken it to choosing a route that they take to work. Maybe the route that they take to work works great most of the time, but occasionally there might be an accident or road work that causes them to run late. Their route, plan of action did not fail. Life just interfered. So when it comes to other problems, they did not fail. There was other interventions that came into play. So it's time. So if you're in the middle of that road work and you didn't know what was there, you pivot. And so it's also important to explain problem solving to your patients in that way, that there are times that you just pivot. So you make the best decision that you can, and then you move forward. And if you have to retool, this is the time to do so. If it was successful, it now becomes the building block for the next goal. So if the patient was successful at this, they now have this confidence and they've got the ability to move to that next level. Because remember, we're hopefully taking these problems and putting them in small chunks and then building on them. So we have just a few minutes left of our hour together. So I'm going to ask if there are any questions that anyone has on the 7 steps or on problem solving in general. And Jason, I believe these slides are made available.
Correct. We will make these available afterwards to anybody looking for them. Feel free to email the My Mind Coordinating Center at mymind@hfhs.org, or you can email me, Jason Robertson, at jrober40@hfhs.org. I'll happily supply those to you.
And if you have any questions directly for me, please feel free. For me or for my team who are on with me right now at PRISM Inquiries at umich.edu. Feel free to outreach if you have any questions.
Awesome. And then just last note to everybody for the CME CEU credits for today. Be sure to log in within the next hour to go ahead and put in today's webinar code, which is 88001. Sarah was kind enough to drop that in the chat for everyone to link specifically. Again, if you have any issues with that, please feel free to email me or the My Mind Coordinating Center as soon as possible, and we can help assist with any issues that you have.
Thank you and have a great day.
Once you create a login, you should be, there should be a place where you can enter the code. So you should be able to enter that code once you create a login. And we sent out some information too via email, Lori, so you might want to check that and see if that's helpful. But if you're still having trouble, just email us, okay? Thank you, Deborah. That was awesome.
Thank you guys for having me. We love the work that you guys do, and it works so well between My Mind and collaborative care. So we're always excited to do anything with your initiative and Henry Ford.
Oh, thank you. We really appreciate that. And it was